Janet, why did you decide to join the DMRF board in 2013?
I'm really fortunate because I had an opportunity to work over the years prior to that with DMRF on a few key projects. I got to know some of the team members and the board members, and I was so impressed. It was a no-brainer for me when Frank Sobey and Alan Shaw approached me to serve on the board. It was an immediate yes, and I haven't looked back since.
Janet, why does health research matter to you?
I feel that health research has an ability to have an impact on every one of us. It's sort of the phrase whole health, but in a way it doesn't just focus on one disease or one problem. It touches everything from mental health to cancer to immunizations. It affects us all. And so I feel that the impact that's made by investing in research has far-reaching implications for all of us.
Has there been a research project that's really touched your heart?
Well, there's so many excellent research projects that we support here, but in particular, in recent years, I've been inspired by the work of Rudolf Ruhr and a program called FORBO. And what that stands for is Families Overcoming Risk and Building Opportunities for Well-Being. Essentially, if they can identify and provide treatment early on for children, for youth, for teenagers, and for their families, they can help save those people a lot of heartache and a lot of mental illness down the long road. And I've seen great evidence of the impact that that's making, and I'm so inspired by that.
Janet, what's it like being DMRF's board chair? And what do you hope to accomplish during your leadership in this role?
Well, it's been an inspiration. I mean, I've had an opportunity to serve on the board for a few years. And I would say that I am just so inspired by all the folks that I get to meet. I get to meet the researchers and understand more about the projects that they're working on. Our partners, our donors, I'm inspired by their dedication and support of DMRF. And I get to work alongside volunteers, board members, and the staff, the great staff team here at DMRF every day. So that excites me, and I think in the long run, what I hope to achieve is to provide them with the support that they need, maybe sometimes to serve as a catalyst for the direction in which we're heading, and live in support of our pursuit of our mission.
Janet, what message do you have for our donors?
I would want to tell them that they are daily, monthly, yearly supporting groundbreaking, transformational, and impactful research here in this region and for those of us who live here, but really their support is having a global impact, and we are so grateful to them. Joanne, you joined DMRF, and then in 2019 you became our CEO. Within months, we entered a global pandemic. What was that experience like for you as a very new CEO?
First off, I'll say it was very rewarding to play a part in advancing health outcomes through research. And the role we played in the COVID-19 pandemic and the generation of knowledge and new developments in thinking and even new vaccines that go into the arms of citizens today, playing a role in all of that has been extremely rewarding. But we didn't forget all of the other diseases and conditions that matter, like cancer, Alzheimer's, mental health, and beyond. And so to continue to be part of that mission of improving whole human health has been extremely rewarding. And it's been fascinating to watch the resilience of our donors who continue to show up, of our staff members who had to learn to work from home, and of our board members who continued to give their time even though their lives were busy. So it's been an extremely rewarding experience. It was exhausting at times and stressful, but I think we had to look at this past couple of years and find the opportunities that we all pulled from the pandemic.
So how do you think this pandemic has changed the face of health research?
I think that a light has been shone on the importance of health research to public wellness, to the economy, There's a massive collective benefit to health research being conducted. And we also saw the power of global collective efforts. So not only funding and the impact that funding can have, but also just a general collective sense of the importance of creating this vaccine or the importance of creating tests for COVID. And if we can apply that to other conditions, like cancer, like Alzheimer's, like health equity, improving access to care, then you can look to the future with a lot of hope and excitement.
Why do you think health research is important, and how has it impacted you personally?
You know, I believe health research is important because it impacts each and every one of us every day in ways that we might not see. This pandemic made it way more evident. However, everything from the allergy pill I take when I wake up to the exercise I do that I know will extend my life, all of those findings have come from many decades of research. On a very personal level, my dad has numerous stents in his heart. My sister has a pacemaker because a virus attacked her heart. Both of those are innovations that have come from biomaterials research. My niece, my 8-year-old niece, has neurofibromatosis, which is a condition where little tumors grow in the body. Without regular MRIs and CAT scans and the development of that technology, we couldn't keep a close eye on those tumors that might be growing behind her eye, in her ear, and allow us to do, the techniques that we need to do in order to save her life.
Joanne, what do you see as DMRF's vision over the next few years?
We intend to continue to support and fund high impact, high quality research that improves whole human health. And we believe that by advancing health research outcomes, we can positively impact the health of our citizens. But determining those priorities, determining what we'll focus on, really has to be informed by what does the public need, what are our health authorities telling us are the pain points, what is the UN saying are our global sustainable goals, and that helps to inform where we should put our energy. And we also look at where Dalhousie's areas of excellence are, so that we can invest in more of what they're doing. Those will be things like continuing to fund mental health, cancer and Alzheimer's. It'll also include, though, looking at health equity, looking at women's health, LGBTQ, Indigenous and Black health, and how we can help those communities have better access to care and further their health quality. We also know that developing the next generation of researchers, continuing that research pipeline so that there are PIs down the road that will continue to carry on this work is an important role for us, and we've played that role for a long time. We also know we have significant depth of expertise in this region in virology, vaccinology, immuno-oncology, and we'll continue to invest in that. And then finally, we want to look for ways that we as a foundation can accelerate research findings so they get to the patient, to the public, to the market faster. And we were looking at what role we can play in that. And so while we have these priorities and areas of our own grand challenges that we want to address with our funding, we also want to be responsive to donors. Each donor has their own personal mission, their own philanthropic goals, and we want to help match that to areas of research excellence. And we also want to be responsive to the public, like we were with COVID-19, so that we're being agile and nimble and responding to the needs of the day.
What message do you have for our donors?
It's really a simple thank you. It's a thank you for trusting us with their philanthropic visions. And through the pandemic, our donors stuck with us. They continued to give, they gave more than they did, they stretched, and because of that, we had our greatest granting year ever last year. But it's also that I hope they keep trusting us, and that together we can have an even greater impact on whole human health.